we talked to today. I just wanted to get your opinion on feeding from elevated or from the floor.
Yeah. Are you talking about with respect to bloat specifically? Yeah. There's a lot of debate on that. Do we not exercise them right afterwards? And I don't know that anybody really knows what. I personally feed my dogs on the ground. I feed them, I mix water in it. Slows them down just a little bit. If not, they inhale it. But it'll slow them down just a little bit. And so I don't know that feeding from a ground or feeding elevated matters that much. Just like I don't know that water matters that much. The big thing is potentially a lot of your dogs are probably not castrated. Is that right? Or spayed? They're intact. Is that right? Yeah. Yeah, so most of the times are, and then the pet population, if you have a large breed dog, Great Dane or something, a Doberman or a Shepherd, that it's not uncommon for them to have the bloat. Whenever they go in, especially in a female, and do a spay, they can do what they call a prophylactic gastropexy, and that's where they actually secure the stomach in a position where it won't bloat in the future. They can do that as a puppy when they go in for the spay, and it just takes a few extra minutes. They're already there anyway. Not so much in a male, because then you have to make a whole new incision, so I wouldn't necessarily advocate that surgery for a male, but for a female, for sure, I think it's a good idea. I don't know that there's any good answer as far as feeding elevated or not, or adding water or not. Even the type of food, some people say, well, feed a wet food or versus a dry food. I don't know that there's any proof that any of those are different.
Yes. When you were talking about bloat, you mentioned something about mixing your dog's dry food with some water.
Yes.
Are you suggesting that I have a dog who just inhales her food. She eats so quickly, and I try and give her just little handfuls at a time. But I mean, should we be slowing down their rate of eating their food?
I don't know. Labradors have been around for a long time, and that's a breed that notorious. And I say that just because most Labradors inhale their food, and it's. I don't know that it makes a big difference. It's just something that I got in kind of the routine of doing. It's kind of like if I fed them elevated versus down. I think it's just a thing I do. It's not something that you necessarily have to do. Does it slow my dogs down? Yeah, it slows them down from about a 10-second meal to a 15-second meal. So, I mean, they are really rapid eaters. So I think it helps a little bit. I think, and I put warm water on it so it makes it a little bit more gravy because I think it'd taste better or whatever. So, do I think that makes a big difference? Yeah, to me it does. So, but it probably, to them medically, it doesn't make a difference at all. Yes?
On the bloat or the flipping of the stomach, now which end of the stomach usually flips? Is it towards?
It can go either way. It depends on the dog, but and it can either be a 180-degree torsion or flip, or it can be a 360-degree all the way around. It can go in lots of different directions, actually. And so what the surgery does is it tacks that stomach to the body wall to prevent it from flipping either direction.
What would you say is the most common cause? Would you have something that's the most common cause? Is it running after they eat, or?
Yeah. Don't know. I think the number one cause is anatomy. I think by virtue that we see, and it's not just large breed dogs, but it is, in proportion, it's deep-chested dogs. I've seen a dachshund that had bloat before. It's because their chest conformation is so deep compared to the rest of their body, and that's why they probably tores. So I don't know that there's lots of speculations, as you guys, if you've read on the internet, lots of things. Don't exercise. I mean, that's the whole theory behind feeding low, feeding high, feeding dry, feeding wet, feeding a raw food, feeding regular food. Again, like with CPR, there's billions of opinions. That's just perfect evidence that there's no good answer and that there's no good science behind why.
Is there anything you should really look for, like you really notice that your dog might have it?
Yeah, sure. The biggest one is unproductive vomiting. If they sit there and they're retching and there's nothing coming up, I mean, and they're drooling typically, then eventually what you'll start seeing is their abdomen start to distend a little bit. If you just hit on both sides, it'll sound like a drum. I mean, it's a huge airfield. But the first thing you're going to see is non-productive vomiting. Their stomach is turned, and they've got this stomach that's expanding. They've got the urge to either belch or to vomit, and they can't. They go through the motions, but that is tied off. It's cinched off at the level of the stomach. They can't do anything. And that's the number one thing we'll see is unproductive vomiting. Yes?
On Jerry there, could you show us if the dog starts to bloat and you're out, where would you palpate to put the needle to?
Sure. Good question. So what scenario would you be in that you would do, like if...
Deep enough into the woods.
Yeah. If you've got something with you or whatever, and I mean, I guess this is where this is weird, but I've thought of like, what would I do for an emergency tracheostomy or whatever, if somebody was choking. So, but if you wanted to do that, what you're going to look at is you want to go in on the right side. The spleen is mainly on the left side. Now, I say that just because simple science says that's where the spleen is, but what happens is when dogs tours, the spleen oftentimes is flipped with it, and so it can be on either side, just trying to avoid a major blood area. But what we'll do is go just back to the last rib, just behind the last rib. You feel that rib, and then aim your needle in a forward direction like this. In these deep-chested dogs, sometimes you may not see a huge distended abdomen when they bloat, and that's because a lot of the stomach sits up underneath the rib cages. And so you may have quite a bit of expansion, and they can't expand the ribs. So you would insert your needle pretty much in a 45-degree angle up towards the opposite shoulder, per se, from the right side. I'm showing you on the left, but from the right side, go in. Okay?
Just leave the needle in and then get him out.
Well, typically what I will do is I will hold, as the analogy is, it's kind of like say it's a water balloon or something. You stick a needle in it. As that balloon deflates, it pulls away from the needle. So what I will do is I will put the needle in and hold it, push it against the body wall, so I'm trying to keep it in the stomach as long as possible, and you'll hear it. And then also what I'll sometimes do is I'll lay them on their side so the air bubble comes to the top. So all the water and gastric contents are on the bottom, the air floated to the top, and then I'll continue just to press down on the body wall and you'll hear it. I mean, it'll just be hissing out of the needle while you're doing that. And then once you start getting fluid come through your needle, you pull out. Okay? Don't hesitate to come up and talk to me. I'm more than happy to talk to you personally. Thank you, guys.